Good afternoon, welcome to Geneva, welcome to the International Labour Organization. My name is Dr. Kevin Teoh, I'm the Executive Officer for the European Academy of Occupational Health Psychology, and we're delighted to be here and to have the opportunity to run this policy event over the next 2 days, hosted by the ILO, and we're very excited and looking forward to that. This is a hybrid session, so we have about 100+ people who signed up across the 2 days to attend in person, and we have about 250 people who are signed up online as well. I believe we are streaming online, and we have the chat function, so if anyone's got any comments towards the end of each session, then please put them in the chat. And as chairs for this session, it's myself and my colleague, Dr. Juliet Hassard, who will be monitoring the chat and taking any questions on for our colleagues. In terms of housekeeping, just some basic things. So today we are in this room. Tomorrow we are going to be in room 2. All our refreshments, if you're in person, it's going to be in the reception area outside, where you'll also find the restrooms. So very briefly, what we have is this opening session where we will have a welcome address by our president, Professor Stavroula Leka, and then followed by presentations by Lucia Vinti and Danielle Guiho from here in the ILO. And then we will go straight into our roundtable session with our presenters in the next session over there. So very briefly, the European Academy of Occupational Psychology has been operating for more than 25 years, and we essentially are the European representative body for the field of occupational health psychology, focusing both in terms of research practice and also education. But that's enough from me. We're going to go straight into it, and I'll hand over to my colleague, Stavroula.
Well, I'm delighted that we're here, and I have to tell you, colleagues, that this is in the making for what, Manal, probably 2 years? I think we met in Morocco at the ECO Congress some years ago, and we said, wouldn't it be fantastic if we came to the ILO and organized an event around psychosocial risks and mental health at work. And so here we are now. And we're delighted to be here and very grateful for the ILO that is hosting us. And we would like to acknowledge the contribution. You'll hear more from them over this day and a half. And for those who are our members and following us, you will know that we have been quite active also in terms of policy making and practice, and work with various stakeholders, many of whom will be with us. And we have a very exciting program designed for you over this next day and a half. It's also a very tight program, so I won't take a lot of time. I just want to say that we all acknowledge that, in fact, the United Nations and its agencies are in a very difficult time right now. And I'm sure all of you will follow the news and the developments. And all the more important, we are very grateful that you're taking the time to talk to us about your experiences and your activities in this very important area, to which we look forward to finding out more over the next day. So I will have some opening slides, and hopefully this will work, and it does. I won't take too much of the time because we have other, as I said, quite exciting presentations. And I think I'm speaking to the converted in this room and online when I say, of course, something that everybody knows, that we are faced with profound transformations in the world of work. That not only have to do with changes in how work is organized and managed within organizations, but the broader context. And the broader context is influenced by a number of factors, and it leads to different changes that also have an impact on our workforce and our societies overall. And so, indeed, work-related psychosocial risks and mental health at work is a global priority. And we do see actually consistent data from many countries that are showing that more of us are struggling with these issues. Employers are struggling, policymakers are putting them in the agenda, and of course, our workers and people are struggling as well. And we do see worrying trends that they see is affecting more and more the younger generation, who are choosing to stay maybe out of work in certain contexts rather than engaging with bad work, as we call it, or not high quality work. Additionally, we do have evidence now to show that in every study, and I'll show you one later on the future of work, this is the #1 priority consistently. We do find in this area various issues that come at play, and you do find different terms being used in the literature. But what I want to show you with this slide is that it's not only about what is bad in a workplace. And this area of psychosocial risk management indeed is aiming at creating healthy workplaces, healthy societies. And it's not only about what is going wrong, but actually what is actually working, the opportunities that are there in the workplace, and how we can strengthen them and build on them to avoid the negative possible outcomes and build to avoid the negative outcomes and build on the positive going forward. And here is the slide, the study I said, one of them that shows that psychosocial risks are a priority. And as I was saying before, the macro context can have a huge impact on the psychosocial work environment. Here you can see the key dimensions that are recognized in the literature in this area. But we acknowledge that the political context, for example, the technological context, the economic, the social and the ecological, including issues such as, for example, climate change or conflicts all around the world, are having a profound impact on our workplaces and the work that we do as well. And then that can have various effects, leading also to significant society effects. And some of you will be familiar with these models. These models were actually developed quite some time ago. And I see many colleagues in the room that actually work with us to develop these models. This was work that we did with the European Commission and the WHO. And we published these models, I think it was 2008 already. And they remain quite relevant today. And what they show is that also at the organizational level, but at the policy level, we can, through a systematic process, assess risks that exist, work in synergy across various areas to translating the knowledge that we get through this assessment into various integrated plans, evaluate them and learn in order to have various outcomes. And it's not only about mental health or generally people's health. It's also about the health of the society, the labor market, broadly speaking, but issues such as productivity, quality, innovation. We now have the evidence, actually, since these models were developed in 2008, to show that this is actually the case. And if we invest in these processes, we can see various positive outcomes that we will hear about. And I finish with saying what I started saying in the beginning, that we do acknowledge that in different contexts, there exist many complications and many challenges, and not every organization is the same. Some are more complex than the others, and indeed the UN, for example, is a very complex organization. Any changes is the way they operate, and you will hear more about that. And with them also we have disparities that need to be addressed, because what we see is that there is no level playing field, as we call it, in terms of prevention. So in some contexts, some countries, some organizations who have a lot of good knowledge and practices, but not everywhere. So we need to work towards focusing on prevention, focusing on using good practices, and that links also to capacity building, enforcement, and coverage of the workforce, and developing evidence-based tools that still, in fact, our enterprises all around the world are asking for. So we thought that when we hear different examples from countries also tomorrow, it will be very important to learn from their experience and see how we can use it to move forward. And with that, I will welcome you again and say we're very excited over these 2 days. Today, we hear more from the UN agency and experience, and tomorrow more broadly across countries and contexts. And I thank you very much for being here with us.
Then next up, I would like to invite Lucia Vinti, who is the program coordinator for the UN Mental Health Strategy team.
Thank you very much. Colleagues and distinguished participants, it's a pleasure to be here today at the ILO to talk about a key issue that we face as organizations, how we understand, manage, and prevent psychosocial risk in the workplace. I would like to thank the ILO for hosting us, and also the European Academy of Occupational Health Psychology for convening such an important conversation. Thank you. So when we launched the first UN system workplace mental health and well-being strategy back in 2018, I believe the conversation looked very different. Mental health was often treated as a private matter, sometimes even a taboo. Openly discussing stress, burnout, or trauma was not yet part of our institutional conversations. But over the past 7 years, we've made real progress. Through advocacy, leadership engagement, and awareness raising, mental health and well-being have moved to the center of organizational discussions. Today, at the United Nations, senior leaders talk about it openly. They champion initiatives, and they recognize that staff well-being is essential, both for individuals and for achieving our mandates. So building on that foundation, the next phase of the UN Mental Health and Wellbeing Strategy focuses really on strengthening systems. We want to move from awareness to action and from individual efforts to coordinated system-wide approaches. A major strength today is this growing system-wide coordination. We now have a shared framework that you can see in the slide. We have common indicators divided under 4 different pillars. And most importantly, we do have spaces to discuss and learn from each other. I believe this alignment is a real achievement and something that we need to sustain and to deepen moving forward. We do have information from across the board of organizations, and we collect information across these indicators. So the scorecard, as we call them, they also make something else clear. While we have advanced in many areas, there are still gaps, and psychosocial risk is one of the most significant among them. You see in this slide, sorry, the numbers are small, but we do have 12 indicators. That indicator 1 of the mental health strategy is psychosocial risk. And as you can see, is the first one in the list, is also our weakest area. From the information we gathered on psychosocial risk management across UN organizations, and we have data from 32 UN organizations from 24, we know that where they exist, responses are often reactive and inconsistent, leaving staff unevenly protected and limiting also our ability to learn from each other. So we know that this is not good enough, and we can and must do better. So this is why the mental health strategy team, under the governance of the implementation board, is supporting the development of a common approach to psychosocial risk management across the UN system. The goal is to move beyond isolated initiatives toward a consistent and a preventive model that can be applied across different contexts. So the management of psychosocial risks is not just another work stream. We believe is the foundation of a safe and a healthy workplace. It is essential to preventing harm and boosting trust. It is also particularly critical in times of change, when uncertainty and pressure can heighten risk and impact the well-being of personnel. We know that building a system-wide approach will require leadership, technical capacity, and above all, understanding. It requires sustained dialogue between experts and organizations at different stages of the journey. That is why gatherings like this one are so important. So over the next 2 days, we have an opportunity to deepen our exchange, to strengthen collaboration, and chart a more coordinated and ambitious approach to psychosocial risk management. On behalf of the mental health strategy team, I want to emphasize our full commitment to this work. We will continue to coordinate across entities and build the capacity and support the solutions that strengthen protection and improve outcomes for staff. To conclude, I just want to say that I look forward to the discussion and working together to make sure that psychosocial risk is not only a shared standard, but is a shared responsibility across the UN system. Thank you.
Thank you very much, Lucia.
Thank you, Kevin.
Can I invite from the ILO, Danielle Guiho, who is the Director of Human Resources. And once again, thank you for having us.
Thank you, Kevin. Thank you. And good afternoon to all of you. Welcome to the ILO. We are very honored to have you here today with us and to welcome this EAOHP event. We are very happy to host this important gathering and provide a platform for exchanging knowledge and best practices that contribute to healthier and more sustainable workplaces. We are living through a very difficult and profound transformation of the world of work and our multilateralism system. Digitalization, remote working, the demographic shift, and evolving employment models are reshaping not only how we work, but also how we experience work. These changes bring exciting opportunities, but they also bring new challenges, especially in the area of mental health and well-being. The ILO is truly committed to mental health and well-being. Since 2022, the right to a safe and healthy working environment has been recognized as one of the ILO's fundamental principles and rights at work. And these landmark decisions commit all member states to actively promote mental health and psychosocial well-being in the workplace. As Lucia just mentioned, the UN mental health and well-being strategy has been developed since 2018. In 2023, we had a very clear system-wide commitment to embed mental health into how we manage people, how we design work, how we deliver on our mandates. And from an ILO perspective, we have launched our action plan on mental health and well-being in December 2023. We have been working very closely with our staff union, with also our COSH working group, and our approach is directly aligned with the UN 3 pillars: prevent, protect, and support. We have implemented a wide range of activities, and I think the team will talk to you a bit later this afternoon about these activities. But it's going from training to return to work programs, to reasonable accommodation and awareness campaigns. And now we are preparing to launch our psychosocial risk assessment, which is a major milestone in our action plan. Our journey on the psychosocial risk assessment began in 2024, but it gained momentum in 2025 when we explored the feasibility of piloting the psychosocial risk management tool, already in use at UNHCR, and the testing at UNICEF. We engaged in deep discussions with EAOHP and with the UN Mental Health and Wellbeing Global Team. And I can't tell you how many hours we spent discussing this topic, reviewing the tool, the methodology, the architecture, and of course, the broader implications of going through such a risk assessment initiative. We had multiple meetings with our IT teams to really understand how we could make it work. And we have finalized the questionnaire. And the team is now going to start auditing our policies and processes, which are quite numerous. So, and then they would be able to identify the stakeholders to train them. We've had discussions on key concerns such as confidentiality, data privacy, as you can imagine. That's why we had so many meetings also with our IT teams. We had also a discussion on ownership and also on, of course, what do we do with the outcome of the assessment? Because it's not just a survey, it's also what do we do with the results? How we take this further? How do we take this in order to mitigate or to control the issues that would have been highlighted in the assessment? This requires a very strong alignment within the organization to make sure that the expectations from all are really well defined and they are set at the right level. It's been a long and thoughtful process, as I can tell you, but we believe that it was meant to be because we need to get it right, and we can't afford to do a psychosocial risk assessment which would not be totally aligned or which would have some issues and that we would not have a good participation of staff, because that's the key element. We want to make sure that we have sufficient participants to the survey so that we have a meaningful assessment being done. The team will tell you more about this later, but I really wanted to thank you for being here today, for your commitment also to advancing mental health and well-being in the workplace, and more specifically on this very specific and complex topic, which is the psychosocial risk assessment. The journey may be long and challenging, but together, through dialogue, through collaboration and shared learning, we can shape meaningful and lasting change. We look forward to rich discussions ahead and to learning from each other as we continue this important work together. Welcome again to the ILO and to the EAOHP event. We look forward to rich discussions ahead.
Thank you very much for the warm welcome and the lovely introduction.
It's an absolute pleasure to introduce the first of several roundtables over the next 2 days, with this one looking specifically around cultivating an organizational culture that thrives on agility, creativity, learning, and adaptability, tenets of the psychosocial risk management process. So with that, I'd like to start by handing over to our keynote address, Marta Helena Lopez, who is the Assistant Secretary General for Human Resources here at the United Nations. So thank you very much. The floor is yours.
Thank you. And so, dear colleagues, it is a great privilege to join you for this important event on psychosocial risks and mental health at work. I would like first to thank the European Academy for Occupational Health and Psychology and the International Labour Organization for convening such a vital conversation at a pivotal time for our global workforce. The United Nations was founded on the principle that peace, security, development, and human rights are inseparable, and that they all rely at their core on people. As we discuss psychosocial risk and the future of work today, we are ultimately talking about how we enable people to thrive and, amid of complexity, adapt to change, and continue delivering for the communities and member states we serve. Psychosocial risk is a strategic imperative for the UN. Managing psychosocial risk is not a peripheral concern. It is a strategic priority, and as Lucia has just indicated, it is the first indicator of the UN system mental health and well-being strategy. This strategy, as also indicated, was first launched by the Secretary General in 2018 and updated in 2023, and reflects the UN system commitment to embed mental health and well-being into the fabric of our work. It applies across all UN entities, providing a shared vision and common framework of how we support our workforce. Through it, we are moving beyond isolated initiatives to embedded policies, practice, and organizational norms that actively promote well-being and prevent harm. I'm pleased to share that the UN system is advancing psychosocial risk management with a common coordinated approach. Pilot projects are already underway, and you just heard from ILO and you will hear from UNHCR, with the aim of scaling up and making this model available across the entire UN system. This will strengthen consistency, enable the sharing of good practices, and accelerate progress. Together, these efforts are transforming how we approach leadership, organizational change, and duty of care, ensuring that mental health and well-being are recognized as essential enablers of how the United Nations delivers on its mandates. Psychosocial risk management is also a core human resources imperative, fundamental to organizational performance, resilience, and mission delivery. It ensures that our workforce, operating in diverse contexts and often under very challenging conditions, can deliver with trust, creativity, and determination. At its core, it is about how we design workplaces, how we lead, how we communicate, and how we shape cultures that enable people to bring their full potential to their work. Indeed, culture and change is especially relevant today in today's multilateral context, as the UN undergoes significant transformations. We are adapting to new geopolitical realities, embracing new technologies, responding to global crises, and evolving how we work to meet the expectations of member states and the people we serve. In this environment, managing psychosocial risk is not optional. It is a strategic driver of change. It enables us to build the organizational cultures necessary for transformation to succeed. Cultures defined by respect, inclusion, trust, psychosocial safety, and continuous learning. It also places human resources at the center of institutional evolution, because the future of the United Nations depends not only on policies and structures, but on the people who bring them to life. Preparing for the future is at stake. The world faces complex and interconnected challenges, from conflict to climate change and digital disruption and demographic shifts, that demand agile, coordinated, and forward-looking responses. To meet those challenges, the United Nations must itself be agile, anticipatory, and resilient. We must build a workforce that is capable not only of responding to change, but also of shaping the future of work. Embedding psychosocial risk management into how we recruit, how we develop, how we lead, and how we support our people is central to this effort. It means creating systems that identify and address stressors early, designing workplaces that foster collaboration and creativity, and cultivating leadership behaviors that build trust and resilience. By investing in this approach, we strengthen both the well-being of our personnel and the UN's capacity to deliver on its mandates today and in the years to come. Our approach is closely linked to UN 2.0, which is the Secretary General's vision for a modern and future-ready United Nations. UN 2.0 calls for a renewed culture and new skills in innovation, data, digital transformation, foresight, and behavioral science to help us meet the challenges of the 21st century. Psychosocial risk management is an essential part of turning this vision into reality. We are developing an innovative, data-driven approach that draws on foresight and behavioral science to help us shape healthier, more adaptive workplaces and ensure we are prepared for the challenges ahead. In short, managing psychosocial risk is how we translate the Secretary General's vision into everyday practice and connect our ambitions with the people who make them positive. To conclude, and as we look forward to the future of work, our shared task is clear. We must not address psychosocial risk as a niche or an individual concern, and instead recognize it as a strategic priority. Achieving this requires leadership, collaboration, and a commitment to evidence-based policymaking, precisely the kind of partnerships this conference aims to foster. Together, we can build workplaces that not only protect health and mental health, but actively promote well-being, engagement, and purpose. In doing so, we strengthen our organizations and enhance the multilateral system's capacity to deliver on the promises of the UN Charter and the 2030 Agenda. Thank you for your leadership. Thank you for your partnership. But most of all, thank you for the dedication to this vital work.
Thank you. What a riveting, I think, call to action, and what a wonderful way to start this roundtable. I'd like to welcome our next colleague, Katie Bennett-Sattler, who's the Director in the Division of People Management in the United Nations High Commissioner for Refugees. The floor is yours.
Thank you, Juliet, and good afternoon, everyone. What a pleasure to be here. Thank you so much to the European Academy of Occupational Health and Psychology, a group of people that I've been admiring from afar and close for a long time, because you've been so instrumental in our way forward, and to our friends at ILO for hosting us. It's as if the forces came together when you said it took you 2 years to get here. Couldn't have been at a better time, though. Because as we look out into the world, this situation that we're all finding ourselves in is just putting mental health right at the center should be putting it at right center of our attention. But before I dive into that, let me also really acknowledge Marta Elena. If there ever was somebody who ran with mental health as a core of the UN system, and making our organizations truly more human, that is you, Marta-Helena. So thank you for that. It's already been said that at UNHCR, we have been guinea pigs and we have been dabbling a bit in psychosocial risk management, and we'll be sharing more about that. But before I go into that, let me talk a little bit about the reality that we find ourselves in, at the risk of repeating what most of you are probably living one or other version of at the moment. Our resources are shrinking across the board, whether you're big or small. Many of us are feeling the crunch. The pace of change, technological, political, organizational, individual, it just continues to move at an incredible pace. And this is the environment where psychosocial risks like to thrive. The risks are really multiplying. People in general are feeling uncertain about the future. People at work are uncertain about their jobs. They don't know what to hold on to in times like this. Work-life boundaries, what are those? Asking for a friend. Constant reform, do more with less. Do less with what? The pressure is enormous on so many of us. And in the middle of this, what we often tend to compromise on is our own mental health. I just have to get through this week. And you repeat that week after week. Let me be very clear. For us at UNHCR, on our journey, we have learned that mental health is not a soft issue. It is actually a very important strategic enabler that allows us as an organization to be better. But the journey there has not necessarily been an easy one. And I don't think I need to tell anybody here about the importance of measuring psychosocial risk, recognizing them, making them visible, tangible, and with that manageable. The importance of that, as you'll hear more from Duda this afternoon, on our journey, how important that has been to actually move from a place of, we have a major crisis, people aren't doing so well, let's send a staff counselor. Varan is a great staff counselor, but she alone, no matter how many great colleagues she has, is going to be able to fix that problem. She might give it a temporary fix, but not long-term, and certainly not on a sustainable basis for the organization. So by having a PSRM tool, it has allowed us to move from temporary empathy to actually integrating mental health risks into our systems. And what we know, managing organizations, that whether you're in a large bureaucracy, often named the UN system, or in a smaller, nimble organization, what we know, if it's not part of how you manage, it falls off and becomes one of those nice to haves, things that are very much at stake right now as everyone's being pressured to reduce and do more of that with less, as it were. For us, we've seen that having a strategic approach, it helps prevent harm, promote healthier workplaces across the board, and build sustainable performance for the organization. And that has been really, really key to actually move from nice to have to something much more tangible for our organization. Marta-Helena mentioned the Secretary General's 2.0 vision. And that, for me, when it comes to psychosocial risk management, is really the compass. It allows us to say, this is where we set our direction. And as anyone who's done a bit of orienteering or gotten lost in the woods, that compass helps you redirect when things come at you, when you have to walk around, when you have to take a detour. And right now, there are a lot of detour opportunities that would potentially risk us straying across. And this is where UNHCR comes in. UNHCR gets debated widely currently in different forms. Is it merely a cutting exercise? Is it actually a potential for reform? The way we see it at UNHCR, UNHCR actually provides us the roadmap to integrate initiatives such as PSRM, to integrate many of the initiatives that have been building over time. And having a PSRM approach allows us to drive all of the changes embedded in that roadmap as a guardrail to make sure that we do perform those changes with people at both heart and mind, and that's absolutely essential for us. Let me dive a little bit into our own reality at UNHCR. We have had significant changes, and some of those have been in the press, and some of those you know of. One of our major donors, who actually ironically is still our major donor, reduced its funding significantly at the beginning of the year, catapulting us to revise our outcomes. Our needs-based budget is about $10 billion. Today, our budget stands at 3.5 billion. We are here to protect and serve the displaced, the refugees. There are currently 122 million people displaced around the world. You can do the math. It's a rough time in my agency right now. A lot of colleagues are worried. Do they have a job? We've lost 5,000 colleagues so far this year, and we're not done yet, unfortunately. In the midst of all of this, whether or not the colleagues who have left were feeling anxiety and sadness, that many had invested in staying in the system for a long time, they saw no other path for themselves, are now finding themselves to look for new opportunities and rethink their entire lives, often with their families. And the colleagues that stay have a mix between, why am I staying? Survivor's guilt, and, oh, how are we going to cope with that workload? So the reality is harsh. It's a tough picture when I look out. And yet I'm struck every single day by how our colleagues show up with such grace and such presence. Sometimes you won't even know it's somebody's last day until they close out for the day, because they've been that dedicated to delivering on our mission. And that makes me both proud and really, really nervous, because we still have our mandate and we are an organization for people, by people. So to be able to look at our organizational change and transformation, and for us, I will dare say it hasn't always been as strategic as one would like when you're moving very, very fast to reduce and also meet a financial target, but we do what we can. In the midst of all of this, to make sure that we actually preserve, which is at the core of what we do, namely our workforce. And then, as luck would have it, we have this tool that we've been working on for several years under Duda's excellent passion and drive, to be honest, and something that we're able to launch this year in truth. We've been piloting and preparing, and the timing couldn't have been better. Because when our managers are now using the tool, they can see where they're going to put the impact of their funding. They don't have the same resources, but where will it make the biggest difference? Instead of following, as we as managers often know, the loudest voice or the biggest noise, now they can actually see, if we invest in making changes here, that can make the biggest difference for the many. And that for me has made it a real business imperative. And in this regard, since we're speaking of resources, I'm so grateful for the support from the government of Germany, who has stuck with us on this and continued to reaffirm their support as we've been maneuvering through changes everywhere else. This is an integral part of who we are and will continue to be so. Some of the lessons we learned along the journey has been data drives action. Don't follow the noise, follow the data. Technology is a game changer. We are fortunate enough to have introduced technology for HR that is truly top-notch, probably better than we know how to manage. And to combine that data and drive real change with a risk assessment approach at the side has made us as much stronger as an organization, even through this situation. Engagement is critical. This is not something that is an HR issue or a psychosocial team's issue. It's actually everyone's opportunity. And equipping our managers with both the skills to be more literate when it comes to mental health, and I'm very proud of our recent learning program that we've developed and launched on this, to equip them with the individual skills, give them the tool to look at where they should be, what should they be keeping an eye out for, what risks should they be managing, and giving them a forum to discuss together in our mental health forum. That has been, to a large extent, a key to success for how we engage on this topic as a whole. and really, really helped us. I like to think of the PSRM as the manager's companion in their pocket to see how are we doing right now and what's happening. And as luck would have it, it actually fits in their pocket. So for HR, psychosocial support, and I'm mindful that not everyone has the fortune of actually having this integrated within their HR teams and their people management teams, but I do. So I see the benefit of making sure that we're able to use data that moves across the entire spectrum. That makes us stronger as a whole, because we are today, fortunately, compared to perhaps where the HR profession was many years ago, looking at people as a whole. We bring our whole selves to work, and that means we also need to look at how our colleagues are operating in the right environment where they can thrive and where they can deliver. Because today, more than ever, performance is critical, but we also know that even the best intended initiatives sometimes have a detrimental impact without knowing that. Now, the tool helps us manage this and helps us also course correct as we move along. What I believe we need to do as a system, looking at the broader UN context, is to move beyond the early adopters and the great partners who've dared to go down this road and say, you know, this is something that I think can work for us. We need to, as Lucia said, make this a platform for everyone. We from UNHCR are very keen to share our experiences. We believe this is the future. I will not shut up about it, because I believe there's a real opportunity here to make sure that our leaders understand that this is what it means to manage organizations through crisis in the future and beyond. We need to make sure that the well-being of our colleagues, of our employees, is a leadership accountability. As I said earlier, in crisis times like this, that's a quick one to forget about. And the reasons for that is not necessarily because somebody is ill-intended, but it's really uncomfortable. And our job as HR or as colleagues working in the psychosocial space is to help them get more comfortable in this process. And tools such as literacy, such as the PSRM, such as spaces where we can have these conversations, help gain that comfort level that you can actually address these things as part of how we do business in the future. So I really just want to say that I believe this is part of the future. Conversations like this need to continue to be part of the reform work that we're doing. Keeping tools that allow us to stay the course for this work and not stray off and lose sight of the compass. They are our guardrails to make sure that we continue to be exceptionally strong organizations for people and by people. You can count on us from UNHCR to continue to be an active advocate and driver of this, and as far as we ever can. And let me just end by saying thank you for creating spaces for conversations like this. Thank you to all the champions, wherever you are around the world, that have helped our journey to get here. You keep inspiring me every day. And also for those who are able to speak up for those who aren't able to speak up for themselves. And all of us together can really make a difference that way. Thank you.
Brilliant. Thank you very much. With that, I'd like to hand over to our next speaker, Thanos Shervatitis. I'm sorry, I've probably not done that very well, who is the co-chair of the UN Staff and Stress Counselling Group, as well as the staff counsellor for the World Intellectual Property Office. So my sincere thanks. The floor is yours.
Thank you. Welcome, everybody. Good afternoon, good morning, good evening to those joining online from different places. I would like also to thank the organizers for bringing us here, creating this platform for discussion and reflection, hopefully. And most importantly, for bringing research, policy, but also the voices from the field and practice together. I would like to present and to bring an insight on a recent developed guidelines on mental health and well-being during organizational changes and transitions. And first, I would like to, thank you. I would like to start with bring a bit of knowledge on what we are, who we are, because we have many non-UN participants. UNSCG is a system-wide technical body from more than 20 agencies, funds and programs in the UN system, consisting of mental health professionals with various backgrounds. And our steering committee consists of 11 permanent members and 4 additional elected members from the wider community in an attempt to have continuity, and also professional diversity. And our mandate is both technical and strategic. We provide technical inputs, we develop tools, evidence-based guidelines, standards, but most importantly, we want to bring collaboration, interagency with external partners, and to build capacity through shared learning and training. Now, we know that when organizational change and any kind of change and transition is not managed with psychosocial safeguards, can become a hazard. And a hazard not only for the individuals, which is very important also, thinking about colleagues who are impacted by stress, by burnout, by loss of morale for the organization, but most importantly, and this is how we relate the discussion with our today's topic, for the performance, for the organization itself. We're losing productivity, we're losing people's ability to work and deliver. And this is something that has major impact on our operations, on the mandate of the UN, as my colleagues also mentioned, and something that we should not allow to happen, especially in these very, very difficult days that we are facing. How we can put this into practice is a question that we all discuss in our different forums between colleagues, with our senior management. And we know we have evidence from research, we have evidence coming from the field that first and foremost, we have to apply PRSCA in our daily practice and to really invest, to, as a first step, identify the risk factors, have a very comprehensive strategy on how to identify in order to mitigate the risk and to potentially intervene to manage them. We need to bring mental health and well-being into our policies, into the discussions with leadership, into our daily interactions. We have the standards that we can follow. We have the mental health strategy in the UN system. We have international standards, and we need to engage our leadership, our leaders, accountability. We need to really focus on that. And I think what is happening with the mental health strategy, the different indicators and the scorecards is the way forward in order to achieve this. What we developed is an evidence-based guideline on focusing on these 3 main pillars: effective, transparent communication, coordinated support. Mental health and well-being is not only a staff counselor job, is everyone's business, is everyone's role to support and to focus on these areas, and also how to bring those who are affected and impacted into the conversation, to be participatory in those who are really suffering, those who are really affected. We know also that we can have some very nice return on investment when we are really focusing on these areas. And this is something that we also always put forward when we discuss and we try to advocate and to convince our management and leadership to really fund this kind of programs, and to remind them that this is not something that we just spend our money, but something that really is a strategic way of moving forward and have a return on investment. Because we have improved resilience in our workforce, we have better retention, and most importantly, we have lower cases that can be on the reputational side of the organization. We can have operational continuity, and this is where we need to focus, and this is the arguments and the evidence that we need to show from the data that we already have. Now, the role of the staff counselor in all this can also be summarized in 3 different pillars. At the beginning of any crisis, and organizational change can be seen as a crisis, we work on the stabilization, and we work on the individual level, on the team level, and the whole organizational level. With different initiatives, with different strategic tools, we can help the individual, but also the team to go through the crisis in a way that it will come out stronger. And there comes the second pillar, which is the reconnection. Facing changes, good or bad, will bring a new status quo. And we are there to work, to bring people back together, to open the discussion, and also to show the organization that we can translate these lessons into a new ways of working, coming together and delivering. Because we need to move forward to the reintegration, again, becoming team, having this kind of way of producing by being in an open environment, not being afraid to share opinions, reflections, and to make that into a nice policy, a nice strategy on the way forward. So if I could summarize everything in just one sentence, it would be that organizational change is inevitable. We know that, but psychosocial harm is not. And I think we need to be living in that and to keep going. Thank you very much.
Thank you so much. And what a wonderful, I think, quote to sort of, for us to sort of reflect on. We invite our last speaker for this roundtable, who will be joining us online. Regan Shercliffe is the Senior Program Officer for the World Bank.
Great, thank you very much, and I hope that you can hear me. Look, I want to, it warms my heart to hear the conversations that are ongoing at this level, to see the level of ownership with psychosocial risk, and to really see the progress that has been made over the past number of years. You know, from those initial meetings in Budapest to the sweaty little room in Geneva, to, you know, full ownership by UNHCR, and I really want to recognize the work that UNHCR has done in all this, and really honor the work that they've done and the willingness they've had to share this methodology and experience. You know, I think, you know, we've just started on this path, and I think, you know, that we really only just, this is the tip of the iceberg, in my opinion. I think, you know, there's a lot of possibilities that we can continue to explore, that we can continue to develop. We can learn from each other. We need to learn from each other. We need to continue working in a collaborative fashion. And I think, you know, in my experience, you know, good ideas don't win. There has to be engagement. There has to be long, sometimes very long, discussions around the utility and why this is important. And then finally, of course, to demonstrate utility, which we're now starting to see, and we're starting to really reap the benefits. The challenges quite often, I'll be frank, aren't technical, they're political. We're talking about transformation in terms of how we, in the larger international development world, humanitarian world, view staff and those environments in which they work. And, you know, I think it's very rewarding to see that, because we're values-driven organizations, and we tend to attract people who work it's not just a job, it's a vocation. And so they come to these organizations because their values connect with the values of the organizations. And so when we work in environments that are fraught with psychosocial risk, it's very impactful on the mental health of our staff. And I want to really point out that mental health in my experience in the development world and humanitarian world is an outcome. It's not a driver. And so the better we can address those drivers of well-being and from an organizational perspective, the better off we'll be in terms of delivering on our mandate. The better off we'll be in terms of engagement. And so I think part of the challenge we continue to have is to really demonstrate the fact that this isn't just, as mentioned before, a soft approach, something nice to do, window dressing, that kind of thing. We're really talking about return on investment. We're talking about engagement of values-driven, motivated, smart, bright staff that I think has been long overdue in these systems. So there are many challenges, absolutely. There will continue to be many challenges. So in my humble estimation, when people say, oh, this may not be the time to take on this kind of approach, this is absolutely the time to take on this kind of approach. And I think we're starting to see the benefits of this. So I do want to reinforce, though, that this is just the start. This is just the beginning of what I think can be a really productive process in, as was mentioned before, using a data-driven approach that's based on excellent research, an excellent foundation to really demonstrate the utility of how this model can be used from a resource perspective, from an efficiency perspective, and importantly, from an engagement perspective, from a motivating staff, and really sort of transforming how we've looked at our workforces. So I really want to commend all the great work that's been done. And there's a lot of challenges ahead, but I really, again, it's really motivating to hear, where this has evolved and where it's going, and to hear all the colleagues on the stage right now talk about it. So, thank you very much to all of those entities and agencies that were brave enough to move this forward. And thank you again for the collaboration and the work and the sharing that all of you have done with this process. And I really look forward to seeing where it goes over the next number of years. So thank you very much for the opportunity to speak, and I wish I could be there, but this is a wonderful opportunity. Thank you.
We have time for a few questions. So I'd encourage colleagues who are joining us online, please feel free to pop any questions that you have into the webinar chat. And for colleagues in the room, please let us know if you've got questions for this fantastic panel. Perhaps I'll start with one, if I may. I mean, my thanks to the entire panel. I've jotted down so much over the course of discussions and reflections today in terms of the importance of a holistic approach, a data-driven approach. I think for me, what really stood out across your reflections was seeing this as a strategic imperative, that this is moving us from not a nice to have, but a necessity for organizations. And I'm just wondering if you have any reflections in terms of, given the global challenges that we're facing and the challenges within organizations, what do you see as some of the key and immediate challenges in terms of moving these ideas and strategies into implementation and embedding them into the fabric of organizations? And I suppose with that, any reflections on how we might tackle some of those challenges?
Thank you for that question. I think there are a number of challenges, but I think the first one that comes to mind is time. Time is clicking, and we are moving very fast. And although we are all committed, the quality of how we do it does pay is important. Obviously, resources. If we had more resources, we could go quicker and go forward. But we are trying to maximize, and I think this forum of sharing gives us an opportunity to build on what has been done. What are the do's and don'ts in order not to spend money and time in those? So I think this is an excellent forum for that. But I think those are two of the big areas that we are having the challenge to put it simple. Not that we have other other challenges. Don't know if Kati and others would like to speak. Kati.
Yeah, maybe my first reaction to your question, Juliet, is how much time you got. But I think the reality is that we're all facing impossible choices right now. You know, and every resource that you have to discontinue, you're kind of happy on the balance sheet piece because, okay, finally you found one, but then you start thinking, well, the consequences, and the consequences are exactly that. We can do less sharing, unfortunately. And we're going to be faced with tough choices. Do we do what matters for our own organization, or do we do the sharing that ultimately pays back? And I think here is typically, and we'll continue to do what we can. We've always been an organization that says, here's a little something we did. If you want to try it, you know, it's there for the trying. But that gets harder and harder because apparently there's only 24 hours in the day. And I think that is going to make it more difficult. What helps when you're having these difficult conversations are the champions. To have senior executives that understand and feel very strongly about a particular thing that matters more in the boardroom than you think. And I think that's something to make sure that your champions know this one we're not going to compromise on. And then I come back and I'm going to start sounding like a broken record. Data helps in all of this, right? Because even though we're talking about resource constraint and political shifting dynamics, it ultimately comes down to showing that this here is, if you go this way, these are the consequences. And if you can back that up with data, the likelihood of going in the other direction may be less. You might still not get to where you want to. And I think that's something we've all gotten used to. But having that and having amplifiers of the voice, so that, if I may say, it would be difficult, very difficult to discontinue certain things for an organization. Make it part of not just compliance, but really, this is such an integral part of who we are. This is part of our culture. This is what we stand for. So if we don't do that, then who are we, right? You got to be a bit sort of, you know, put it out there because this is also emotional. It's not just resource related.
Just let me add that having a partnership with the academy is important because you need also from outside to have that steer. You know that we are going all through very difficult times. So knowing you are there is very important, even if you're not us, but you understand us.
I was actually going to ask a question around that, so thank you. And it's been our pleasure, of course, to engage with you through the academy. And my question that I will ask again later and tomorrow is, what would you like to see in terms of the future and strengthening this partnership in an ideal world? What would you like to see? Because I think part of this event is important about looking forward. And we do have not only the European Academy, but also other associations here around the world. We have chairs from the International Commission of Occupational Health Scientific Committee on Psychosocial Factors at Work. We have the equivalent of the Academy in Asia Pacific. The president is here. And tomorrow online, we will have the president of the Society of Occupational Health Psychology, which is representing it's based in the US, which is going through a very challenging time at the moment, but representing widely the Americas. So what would you like to see from us and how can we support you more?
I don't want to dominate, but you just asked like a wish list question, and it's too good of an opportunity to pass it up, really. I'd like for us, they say never waste a good crisis. I'd like for us all to learn from this crisis, from the mistakes we inevitably will be making, so that in the future, how this room, this virtual room online, how this is working is how we're all working together. I got really excited to hear that you have such an international representation of dedicated individuals. And we may not be 1,000 people right now, but we don't have to be, because we're so widely linked up. And to echo what Marcelena said, the link between those of us who put this into practice with those who are in research, those who are in academic settings, those who are actually doing clinical work, so that we have the full cycle. That makes it too difficult to fob away, for want of a better expression, which I think we've gone so far now already. It is just reflecting back to 2018, how far we've come. There's a lot to be proud of within the UN, but we're not immune to the world we're living in. In fact, we're stronger with that. I'd like to see more explicit partnerships in the future. I'd like to see that mental health is, yes, viewed as a risk, but the protection and the promotion of it is a leadership skill and an accountability that actually gets talked about all the time. It's on the table when the big discussions are happening. I mean, you asked for my wish list here, so not shy.
I'm going to sort of welcome in Regan, who I think has his hand up. So if I can hand over to you for any reflections or comments.
Yeah, great, thanks. And I think just building on what Katia had mentioned and Marta as well too, in terms of having the academy present. In my experience, having those colleagues on hand for the demonstrations, for the discussions, and there's been quite a few, has been crucial in terms of really demonstrating the utility of how this can work. So, and I really want to thank the Academy for their patience in this process, because we're talking about large bureaucracies where change is incremental. But you're really starting to see the needle shift. So any way we can strengthen those partnerships, any way we can continue that collaboration, I think will be really beneficial and quite honestly crucial as we move forward. So I just really want to thank the Academy for all the support that they've provided, and I really look forward to deepening and building on those relationships. So thank you.
For those of you who are not going to be with us tomorrow, you might have noticed that in the folders, I believe you will see that there is a Geneva Partnership Commitment document included, which the presidents of the scientific associations in this area are going to sign at the closing session tomorrow. And with that, we are anyway working together for many years, I think, dear colleagues. But what we're trying to do is make it more sustainable, make it more explicit, and putting out there a commitment that we will work with you and continue to support you. And we will draw on resources globally to do that. So we're very proud that we're able to do that tomorrow. And I'm just saying it there not to spoil the fun, but just so that you're aware in case you're not with us.
Brilliant. I think we have a question in the room. Yes, please.
Thank you, Tina Leakey, WHO Transformation Office. I have two frank questions to the esteemed panel. I couldn't pass the opportunity. The first one is, especially for the agencies that have been implementing this, what were the biggest concerns you got from leadership, from senior leaders? And how did you address those, or how did you overcome those? And the second one is slightly playing devil's advocate. We've talked about resources. Assessment requires action. Action requires resources. And aren't we running a risk of generating a lot of expectations and not being able to follow through? Thank you.
think for the first one, it's Niela and Hattie, perhaps.
Yes, so as I said a bit in my introduction, the challenges are quite high. And indeed, the whole discussion on ownership and also on what we'll do with what we will be doing with the results are really key in the whole discussion. So it takes a while to explain what it is about, and to explain also the difference with an employee engagement survey, because questions may be the same. So what's the point of having another survey? Really a lots of discussion on the rationale for launching this tool. And then once everybody's aligned on it, what's next? So what are we going to do with it? Because it could be frightening in a way, because it is a big word, psychosocial risk. It's a huge word. And in our world, this could lead to a lot of consequences. So it's quite tough to go through that. And we need to face really this. We need to face the idea of, yeah, well, we may have, areas where we have psychosocial risk, and we need to face it and to decide that we want to do something about it. And beyond the words, beyond the window dressing thing that Regan was talking about, what do we really want to do to really tackle this? And we may not be able to completely mitigate it, but at least to control and to be aware of those risks and not just hide everything under the carpet. So I don't have an answer to your question, but really we've been through this exercise, and it's been a complex approach for sure. But we are getting there, and maybe next time we can talk about the results and what we did actually with the results.
And then on the issue of resources, I think the most expensive ones are the ones who go first. And that's why we are investing in those, because as we advance, we learn more, and that is going to be then shared. And I think here what we have is a commitment of all of us to support and to share. Not doing something is not a choice, because it will become more expensive. However, in the results, we don't have to do everything. We can prioritize at that point in time. It may take longer. But not doing anything is much more expensive. I give you an example. We did a staff engagement survey. All the heads of entities are asking, I don't want an action plan. I don't have a time for an action plan. And I said, I don't care if you only have time for one action, but we need to advance the agenda. It may be slower, but there is no excuse not to advance the agenda, because it will become more expensive and it will be more difficult for us, and our people should come first. So I think it's upon us to really make the case. And I think we have very good partners to help us make the case, and they know our struggles. And I know we can count on all of you and all of the others that you have mentioned to help us with. But I think this is not the time to think, oh, we're not going to do it. We may not do everything, but we just need to do something in advance. Thank you.
Can I compliment very briefly? I promise I'll be short, but I think that Marcelena and Danielle, you've said it really well. The first question my leaders tend to ask is, who else has done it and how did it go? And they won't listen to you, or in this case, me or Duda and our teams, as well as they will listen when Danielle comes and shows how she did it. It's psychology, meaning happy to come. I've been to WHO before, talked about technology, but this is the other side. Use us to talk about our journey. It's not only a walk on roses, but I come back to what Magdalena said. Can we afford not to do it is the question, right? And then you bring in the data on burnout, on the risks, because I think every leader who goes through a transformation is wondering if they're doing it right. And here you actually have data to say, you're going in the right direction, or here's an opportunity to course correct. So it gives them those guardrails, actually. So, you know, I think it's a question of expectation management always. But for organizations, I know you're not in dissimilar situation to us, also with a big transformation agenda, the question really becomes flipping it back. Can you afford not to?
If I can bring also another perspective to your question, is that from my experience, and it's logical and practical and historical why, but when it comes to mental health and well-being and staff counseling, not only the UN system, in outside as well, many different stakeholders and actors and partners know what we should do, and not very often we are on the same table as experts. This is changing a lot, and it changes with the nice leadership that we have now, with the strategies that we have developed, but we are not on the level that we would like to be. And that's why we call not only for the risk assessment in the scorecards, but also for resources in terms of, you know, all the regions to have at least a staff counselor, to create teams, to create structures, because one person can make a difference, but if we have a team, we can make a bigger difference and we can achieve more. And to advocate for that is also extremely important. And of course, when it comes to outcomes and solutions, we cannot do everything at once. But these tools and this assessment gives us a roadmap that we can really spread out in time and we can prioritize.
Can I just add, we did not put the first item as risk assessment just by chance. It was on purpose, because that's the first one a leader is going to read. They may not read all the others, but I'm sure they're going to read the first one. So it was on purpose that it was put first. So if you're speaking to our leaders, if you want to only do 3 items, do 3 items, but never forget to do the risk assessment.
Brilliant. Thank you very much. And I might just highlight, so Regan has also put into the chat here, which I think builds so wonderfully on so much of what's been highlighted here. It's important to note that this is the start of an iterative process, a data-driven approach to assessing impact of organizational culture. So I think it's really important to, again, highlighting all that sort of wonderful reflection. I know that we're just in the heart of the coffee break. We do have one question online, which in a way, if you'll indulge me, I'd love to just get in quickly, because I think it's such a wonderful segue into the next session where we're sort of shifting focus in terms of thinking about implementation and the opportunities and challenges around that. So the question is, do you have best practices on how academics can foster partnerships and involvement with unions, governments, national and international bodies, etc.? It's a big one.
This is one of them, I think, that we have started, and I think it has been a nice journey. I do want to echo Regan to say, in order to partnership with us, we do need patience, particularly at the beginning, and I think that is key. But I think this has been one of the examples, the big examples, that is going to have very lasting effects within not only one entity, but all the entities within the UN system, and with a large international workforce. So it is an opportunity to show something not in one location globally, not in one organization, but on various organizations, and something that could be used outside the UN system with other international companies, with other international organizations, other regional organizations. So I think this is an opportunity that I think, as Regan says, in 100 years' time, they will say, oh, what they did and what we achieved.
Legacy.
Brilliant. Thank you so much to our panel, both here and also virtually. So I think we'll give them another Round of applause. Just to sort of highlight to those in the room and also our online colleagues that we've got a fantastic session coming up. And for those of you that are joining online, it's the same link that you've joined if you need to join us back.
Brilliant. So yeah, we'll carry on in half an hour. And I think to the point about learning about what others are doing, we'll do a deep dive into the practice and hearing from a UNHCR, from UNICEF, and also the ILO too. So I think we'll explore that question in a little bit more detail. So enjoy a little break and we'll pick up later on.